Exposure therapy is the most effective treatment for anxiety and a variety of anxiety disorders. But what do you do when exposure therapy doesn't seem to be working and your anxiety isn't improving? In today's video, we're going to be talking about how to troubleshoot problems with exposure therapy to help eliminate your anxiety. Hi everyone. You've probably heard of exposure therapy for anxiety because exposure therapy makes a lot of sense. The idea of facing your fears and overcoming them. But what do you do when facing your fears doesn't seem to be working and the anxiety persists? In today's video, we're going to be talking about some of the most common problems people encounter when doing exposure therapy and what you can do about them. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. Now, with those things out of the way, let's start talking about troubleshooting exposure therapy. Now, I did a previous video recently on exposure therapy for anxiety. The idea of gradually desensitizing yourself to whatever it is you're fearful of by working your way up an exposure ladder. And if you haven't seen that video, I'll link up to it above. I encourage you to sort of take a look at that video first because it will help give you some context to this video. So the idea of doing sort of this graduated exposure is that it helps reduce your anxiety by giving you experiences with feared situations or objects that you might be avoiding. So if I'm fearful of social situations, I'll do gradual exposure to increasing my interactions with other people. If I have generalized anxiety disorder and I'm worrying excessively, what I'll likely do is some gradual exposure to uncertainty to overcome that intolerance of uncertainty that drives my anxiety. If I have PTSD, the idea is to do gradual exposure to situations, people, activities that may trigger trauma memories. If I have a specific phobia, like a fear of dogs, I'll do gradual exposure to increasing contact with dogs. So this idea of gradual exposure makes a lot of sense, and it works really, really well to overcome anxiety with time and practice. But what happens when exposure doesn't seem to be working to reduce anxiety? So some examples I'll often come up with, or my clients will often come up with, is things like fear of driving. So even though I try to drive, even though I'm still driving on occasion, I'm still anxious and it's not getting better. If I have social anxiety, I'm around people all the time, but I'm still anxious. If it was just about exposure, why would I be anxious because I'm around others all the time? You can also see this in other anxiety conditions as well. So what exactly is going on? Why isn't exposure in these types of situations working? Well, the idea is it relates to how the person approaches doing the exposure. And so I like to make a distinction and a differentiation between what I call typical everyday exposures versus therapeutic exposure. And typical everyday exposures and therapeutic exposures vary on a range of different aspects. So in everyday exposures, the idea is you're doing exposures as part of your everyday life. So I'll drive to a grocery store because I have to. I'll drive to work because I absolutely have to. I'll do that presentation that I have to do for school because I don't have a choice to not do that presentation. I'll touch that doorknob to get into that building because I need to get into that building to get to my meeting. So you have these exposures, but they're not really what we call therapeutic exposures because they're not really things that you have control over. You're kind of forced to do them in that situation. Whereas therapeutic exposures are the types of exposures that I get people to do as part of exposure therapy. So, everyday exposures differ from therapeutic exposures in a number of ways. The first is predictability or controllability. So in everyday exposures, the exposures that a person encounters are usually unpredictable or uncontrollable. I find myself unexpectedly ending up in a feared situation or forced to endure a feared situation that I wasn't anticipating. So I'm in my university class and my professor asks me to stay behind after class to talk to me about something. I wasn't expecting it to happen. I wasn't planning for it to happen, but it's now happening to me. Whereas this is different from therapeutic exposures, which tend to be predictable and under your control. In therapeutic exposures, you're intentionally making the decision to enter the exposure situation and knowing that that's going to raise your anxiety in the short term with the goal of making it an exposure that's addressing the anxiety. So there's an intentionality to these exposures in therapeutic exposure. So I'm going to be approaching my professor after class to ask a question. I plan that ahead of time and I make that happen rather than the professor unexpectedly asking me to come up and talk to him after class. Typical everyday exposures and therapeutic exposures can also differ on the duration. So everyday exposures tend to be short duration. So I find myself in the feared situation, I feel anxious, and I do my best to escape the situation as quickly as possible. What this does is it teaches me that when I'm in the situation, I get scared, and how I deal with that anxiety is I have to escape, and then I'll feel better. This maintains anxiety. This is that avoidance that just keeps the anxiety cycle going. Whereas in therapeutic exposures, the exposures tend to be prolonged. The idea is you stay in the situation and you persist in that situation even though the anxiety is uncomfortable. And I stay in that situation until the anxiety starts to go away on its own. By persisting in this situation, by persisting with the exposure, it teaches me that I can tolerate the anxiety and that it will go away on its own without anything bad happening. Another way everyday exposures differ from therapeutic exposures is the frequency of exposures, how often you are engaging in these exposures. So everyday exposures tend to be infrequent or things that I rarely do. Because I avoid anxiety-provoking situations, I may not find myself in those situations very often. So if I limit how much I'm driving, I'm only going to drive when I have to. So maybe I'm only driving once every 2 or 3 weeks. But every time I drive, it's like I'm starting all over again. The anxiety is there. Whereas in therapeutic exposures, the idea is to make the exposures frequent, to practice the exposures over and over again on a frequent basis. So rather than going driving once every 2 or 3 weeks, I'm going to be driving 4 or 5 times a week. The benefits of doing the exposures frequently are that they tend to build up my tolerance, and it starts to reduce my anxiety the more and more I do the exposures. Another way that these exposures differ, the therapeutic exposures from typical everyday exposures, are the thoughts or what I'm thinking as I'm doing the exposure. So typical everyday exposure usually involves thinking that promotes anxiety. So I usually find myself in a situation where I don't want to be in that situation. Maybe a situation I wasn't expecting to be in or that I was unprepared to be in. And so I might find myself thinking things like, I can't stand this. This is awful. This is never going to end. I got to get out of here. These aren't thoughts that help bring the anxiety down. These are thoughts that make the anxiety worse and drive the anxiety. Whereas in therapeutic exposures, remember, you're doing the exposure intentionally for the purposes of exposure. So I'm prepared. I have a plan going into the exposure. So I can be thinking about thoughts that might counter my anxiety-provoking thoughts in that situation. Things like, I know I can stand this, I know I can tolerate this because I've been in this situation lots of times before. This is gonna pass, this is gonna get better. I know this is uncomfortable, but it gets better if I just sit in the situation because I've done this exposure before, yesterday and the day before, and it got better. These are all ways that I can coach myself through the exposure as part of the therapeutic exposure, which wasn't or may not necessarily be the case in typical everyday exposure where I just find myself in that situation. These two types of exposures can also differ on subtle ways of avoiding. So there can be ways that you're avoiding a situation even if you're doing an exposure. We call these safety behaviors. So in typical everyday exposures, these can take the form of things like distracting yourself while you're doing the exposure. It's almost like you're escaping in your mind while you're doing the exposure. Another thing that people will often do is to have someone with them while they're doing the exposure in case something bad happens, or doing something that makes you feel safe while you engage in the exposure. I'll often see this with some of my panic disorder clients who will carry Ativan with them while they're doing the exposure just in case they start to feel anxious. So these are all subtle safety behaviors that are kind of subtle ways of avoiding or not fully engaging in the exposure. Now, in therapeutic exposure, the idea is if I'm going to do the exposure, I'm going to do it fully. I'm going to immerse myself in the exposure to try and maximize the anxiety at this level of exposure hierarchy in order to maximize the benefit that I'm getting from the exposure. So the idea is in therapeutic exposure, I drop those safety behaviors that are subtly undermining the benefits of the exposure. Because as long as I'm engaging in those safety behaviors, what I'm doing is I'm telling myself that something bad could happen. So the key is in therapeutic exposure, you're eliminating these safety behaviors and doing the exposure fully. These types of exposures also differ on acceptance of fear. Now, in everyday exposures, people will often perceive experiencing anxiety as a bad thing. If I feel anxious, it means there's something wrong. I'm doing something wrong. If I feel anxious, I failed at whatever it was that I was doing, this exposure that I was doing. So there's this need in typical everyday exposures to constantly fight anxiety or constantly try to make the anxiety go away. This is different from therapeutic exposure, where the whole purpose of the exposure, the whole goal of the exposure is to experience anxiety and ride it out. So in therapeutic exposure, there's a recognition that anxiety is a part of life and that I don't have to fight it every time it comes up. But rather, the idea of the exposure is to help me learn that I can feel the anxiety, I can learn how to cope with it and any feared situations associated with it, and that the anxiety will go away on its own. And finally, typical everyday exposure is different from therapeutic exposure in terms of the definition of success, how I determine whether or not I've been successful with the exposure. Now, in everyday exposure, people usually define success as the absence of anxiety. So it's success if I go to that party and don't feel anxious. It's success if I walk by that dog and don't feel scared. It's success if I walk away from my car and I'm not anxious about whether or not I locked my car. So the goal, the idea of success in therapeutic exposure is to not feel anxiety. And if I feel anxiety, that's a failure. Whereas in therapeutic exposure, success isn't determined by anxiety. or whether or not you feel anxiety, success is determined by the behavior, not how you feel doing the behavior. Because, as I've talked about in other videos, you can't directly control your feelings. You don't have direct control over your anxiety. Because if you did, you would choose to not feel anxious. So the whole goal of exposures is to do the exposure regardless of whether or not I feel anxious. And so I determine success whether I did the exposure regardless of how I feel. Because if I'm doing the exposure, there's a good chance I'm going to feel anxious, because that's the whole point of exposure. If you're not feeling anxious doing exposures, you're probably not doing it right. You're probably engaging in a lot of those safety behaviors, or you're doing exposure to something that doesn't make you anxious, and so you probably don't need to be doing exposure to it. So those are the key differences between a typical everyday exposure, where a person feels like, yeah, I'm doing exposure, but my anxiety isn't getting better, versus therapeutic exposure, which is really about the idea of exposure therapy to eliminate or reduce anxiety to these various situations or feared objects or items. So if you're going to be doing exposure therapy, this is the formula for doing exposure therapy the right way. These are the components that you want to ensure that you're doing as part of the exposure to make sure that you're doing it right. So the exposures are predictable. They're in your control and planned by you ahead of time. The exposures are prolonged in duration. You stay in the exposure situation for as long as it takes to experience the anxiety and tolerate the anxiety. You do the exposure on a frequent basis, multiple times a week, so that you can build on your exposure practice and your exposure experiences. As you're doing the exposure, you're countering anxiety-provoking thoughts and challenging those thoughts as they come up, essentially coaching yourself through the exposure. You do the exposure fully, immersing yourself in the exposure and dropping any of those safety behaviors or those subtle ways of avoiding while you're doing the exposure. You accept that you're going to feel anxious while you're doing the exposure, because that's the whole point of doing the exposure. And you define the exposure as a success based on your behavior. I did the exposure, so I succeeded regardless of what level my anxiety was. So if you make sure your exposures follow this formula, if your exposures look like this, they're most likely going to work, and your anxiety is most likely going to get better. So it takes effort. It doesn't feel great while you're doing it, but it absolutely works. So I'd love to hear your thoughts and ideas about this. Have you experienced this difference between therapeutic exposure versus your typical everyday exposures? What have been your experiences with this? So please leave me some comments or questions in the comments section down below. If you've been enjoying my videos and would like to see more, please hit that subscribe button and notification bell, and you'll be alerted every week when I post a new video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.